Welcome back. Continuing on from the first part of the presentation, we will go on further discussing stroke awareness and your health. So what is happening in the brain and in the bloodstream during a stroke? Before we can begin discussing this topic, it is important to remember that a stroke is simply a sudden loss of brain function. Now, how does this loss of brain function happen to begin with? As you may know, our body is filled with blood. Blood is important for carrying oxygen and other important nutrients like glucose, which is a type of sugar, to all the parts of the body. So let's break this down into simpler terms. Let's think of blood as a school bus. The role of the school bus is to safely pick up all the students up from home and drop them off at school. In this example, the students would be oxygen, glucose, and other important nutrients. So our blood, or the school bus, brings oxygen and glucose to all the important parts of the body, such as the brain. The brain needs these nutrients as well as oxygen in order to function. But how exactly does a school bus know how to get to the brain? Well, this is where the arteries come into play. We can think of arteries as roads in our body that directs blood to where it needs to go. So in summary, the school bus, or the blood, picks up all the students, oxygen and glucose, and begins its journey towards the school using the arteries as a road to get to the brain. So how does this all relate to stroke? Well, remember from the first module that some strokes are caused by a blockage in an artery in the brain. The blockage is like a traffic jam on a busy road. You really want to get to where you want to go, but there's no way of doing this because of all the cars jammed up in traffic. So if there's a blockage in the artery, then the blood has no way of getting to the brain, which means that none of the students, the most important being oxygen, can be delivered. This is very much the case with ischemic strokes. This is a huge problem because the brain is unable to function properly without oxygen. This is why time is so important for getting help when you think somebody is having a stroke. The longer it takes for somebody to receive medical attention, the longer oxygen is unable to be delivered to the brain, which may result in greater damage to the brain and the functions it's responsible for. Recall from the first module that there are generally two different types of strokes. One is an ischemic stroke, and the other hemorrhagic. Ischemic stroke occurs with the narrowing of the artery, or tube in the example on the last slide, is preventing healthy blood flow from occurring, while a hemorrhagic stroke occurs when a weakened blood vessel erupts in the brain. One important point to keep in mind is the fact that different parts of the brain control different functions of the body. This is very important to understand, since it means that depending on where a stroke happens in the brain, it could potentially disrupt a specific function in the body. Sit tight because we'll be teaching lifesavers like yourselves on how to identify and help someone who may be having a stroke.